Hi, everyone. Welcome to the Reframing Eye Care podcast. Our guest today is Joe DeLoach. He is an optometrist. Welcome to the podcast.
Well, thank you.
It's such an honor to have you on the podcast today. You started Practice Compliance Solutions in 2011, but spent most of your career in management of ocular disease, retinal disease, and glaucoma, and really founded this over the last few years and have done a lot in the industry with this, practice compliance to really help optometrists with medical reimbursement and compliance in healthcare law. So welcome.
Thanks.
It's a lot of corporate optometrists don't think they have to comply to certain healthcare laws, and that's a big myth in corporate practices. So that's why I wanted to have you on and talk about this. Can you give us some information on what you've done over the years just to show your expertise, and then we'll ask the most common questions that kind of happen.
Yeah, I mean, my main interest in kind of compliance came through years of working in the reimbursement side of things. So Medicare consultant for years, Medicare planning counsel for years, Medicare auditor for years, but it was all really related to medical reimbursement, which encompasses a whole bunch of healthcare laws that a lot of doctors don't even realize that, they look to a payer program or a blog speak or something. Most of the reimbursement issues are handled by federal laws that are in place. So that's kind of, I got interested in compliance with laws. Then when HIPAA came out, I was actually asked by the Texas Optometric Association to make sense out of HIPAA, which I thought was an interesting concept until I read HIPAA and understood why they wanted somebody to make sense out of it, because it makes no sense whatsoever. So we started just with the concept of trying to put something together that people could actually understand and utilize in their practice in an easy way related to HIPAA. Then we found out that healthcare compliance is way bigger than HIPAA. And that myth still persists to this day. Most people say, well, healthcare compliance, it's HIPAA. And some people throw in OSHA because they've heard about OSHA, but there's probably about 22 different areas of healthcare compliance, fraud and abuse laws. We can throw HR in there, and things that just come out constantly, like No Surprise Act, like Corporate Transparency Act, all these things that you have to do as a doctor that are absolutely not the army anyone signed up for when they decided to take care of patients. But that's where healthcare is now. So healthcare compliance got rather massive, and we made the decision to find easy answers to all that stuff, as opposed to just concentrating on HIPAA or OSHA.
Yeah. So most people think compliance just means HIPAA, but what else what else is involved with like compliance?
Yeah. So, I mean, you have the other probably biggie is OSHA. But, healthcare compliance is human resources. So your HR, your employee stuff, corporate transparency laws, No Surprise, the Cures Act, medical reimbursement, falls into that same category as well. But it's just a bunch of little stuff like your website, your website compliance laws, service animal laws, patient disability laws. There's all this stuff that people don't think about that's out there. And none of it's really new, except, some of the newer things like the No Surprise Act and things like that. But a lot of this stuff's just been on the books for years, and people just don't really pay attention to it until something happens. And that's why we really got involved, is we started being looked to as, I'm in trouble, help me out. And that's actually where most people are introduced to healthcare compliance, is an attorney calls them or a federal agency calls them and they've done something wrong. And most of the time it's, I plead ignorance, I didn't know. But none of these laws allow ignorance to be an excuse. So you're actually obligated to know this stuff. So it's really big, and it just keeps growing. I mean, like every year we're adding 2 or 3 more new things that have come out that we all have to do, including corporate practices.
So tell me, can doctors really get in trouble, and what are the penalties for non-compliance? Because you're saying a lot of them ignoring it or don't know about it.
Yeah. most of these compliance laws carry administrative fines. So it's kind of like the IRS. I mean, you get in trouble with the IRS, they don't throw you in jail because they want you to have a productive income so you can pay the fine. Well, these federal agencies do the same thing. They don't want to throw anybody in jail, and they rarely do, but they have fines that they will impose upon you. And many of these agencies, the fines are absolutely gagging. Now, most of them have like a maximum fine. I can give examples. Like I use the concept of patient disability. Violation of patient disability can be up to $75,000. Well, it doesn't mean everybody gets tagged for $75,000, but that's what they can do to you. The big ones like HIPAA, $250,000, OSHA, $500,000. These are all the maximum amounts you can get tagged. Most of the time, they're not that big, but even $20,000, $30,000, $50,000 fines here and there are not really good for the bottom line.
Yeah, I mean, that's a lot of money for any practice, right? I mean, a lot of doctors go into a sublease. They think everything's kind of ready for them. They just turnkey. That's how they advertise it, but they don't know about these things when they take over a business. Give us some insight on that with the sublease holder. Are they liable just for their employees? Are they liable for the optical side? What are some things that they should watch out for?
Yeah, I said that, this concept of corporate practice or whatever we want to call it, it's really no different to me. I mean, I don't even like separating it out as something different. I mean, it's just another location. There may be some other relationships involved with it, but hey, we're all taking care of patients exactly the same way. So I don't really see it as a different kind of optometry, and the government doesn't see it that way either. But it does sometimes pose some interesting nuances with these laws because we have relationships with franchise owners or relationships with a business that actually runs the franchise. And those can introduce some weird kind of issues because when they wrote things like HIPAA and OSHA, they really were under the mindset of you own the business, you're responsible. And they didn't think about franchises and private equities and all this stuff because most of it didn't even exist when these laws were written. But there are some unique things, and I can use HIPAA as a really good example. We travel all over the United States actually doing consultations in offices. And one of the things I see a lot in some corporate settings is like you're in a retail environment. I don't like to use any particular company, for example, but in that retail environment, you don't really have any control over the optical, but optical actually has insight into your business. So like they make appointments for you when you're not there. They handle patient complaints for you. Well, these are patient information interactions that fall under HIPAA that are unique to that kind of situation. And they still have to be answered. And there are ways to deal with these unique situations, but those can pop up. Sometimes those employees on the optical side are actually shared. So they work over there part of the time, they work with you part of the time. All things that can be managed, but they're kind of unique. Now, you brought up the concept of who's responsible. And I think much like people think HIPAA is the only compliance thing out there, a lot of people think it's all the owner. Everything's on the owner. And that's not really true at all. And as a matter of fact, even in this last year, there was a major Supreme Court decision that basically said that an employed doctor, or in some cases, even an employed staff member, are responsible for what they call the upstream policies of the employer or the person you're working under. And if those policies are not in effect, the downstream employees can actually be held individually liable. That was a massive decision. And, our company does the practice management course for the University of Houston. And we tell the students this, it's like when you get out, make sure you are protected because you are not immune from this stuff just because you work for someone else.
Yeah, I mean, they're really high risks. How many colleagues do you think really ignore these laws? Is it 90%? I mean, I think it's pretty high, right?
It's not 90%, but it's pretty massive. It's kind of hard to come up with really good statistics on this. At one point, OCR, Office of Civil Rights, who manages HIPAA, broke it down and by specialty. And at that point in time, and this was 8 or 9 years ago, they said that in optometry, less than 50% of doctors were compliant with HIPAA. You got to understand, HIPAA is the most well-known and the one most compliant.
I'm surprised. What
yeah.
are some HIPAA violations? I mean, I thought everybody knew HIPAA and complied. What are some common things that you see that are violations in our industry?
Obviously, HIPAA was designed to protect patient information as it is transmitted from person to person, from company to company, from referral source to referral, wherever the information is going. We're obligated to protect that transmission so that information is not leaked out. So that is the most common thing that happens, is a violation or a breach, as we call it. Information is leaked out due to IT errors, due to staffing errors, sometimes just due to just not paying attention. So a little thing a good example, a little thing that happens a lot is like someone's medical record or their invoicing or something. The staff will mail to the wrong person. And of course they get a phone call. It's like, I got these medical records, they're not mine. Well, that's a breach. And those things have to be handled in a certain way. Those are pretty common. The biggest thing in the last probably 4 or 5 years are, of course, cyber attacks. So we have cyber criminals coming in and stealing your database, stealing all the information. And that's an absolute critical stage in the United States, actually all over the world, but in the United States for sure. And there's just a whole lot of things you have to have in place to minimize that risk. So sometimes we get asked, can you eliminate all risk of breach or cyber attack? And the answer is no, because the cyber criminals are that good. But what you have to do, and what HIPAA, and we keep concentrating on HIPAA, but most all of these laws, you have an obligation to do the best job you can. And that's individual based on your individual business. So what is good for your practice may not be the same rules and regulations and policies for someone down the street, because their practice is different, their patient load is different, their location's different, they live in a high crime area, you don't. So it's all very individual. You can't just cookie cut all these compliance laws that apply to everybody out there.
Okay. So here's the thing that kind of shocked me. What you said before was, it's not just the owner of the practice, it's the associates can get in trouble. What about staff? Can sometimes you're saying like staff makes errors. Can staff be liable too? I mean, if we teach them, we coach them, we give them resources, we train them, are they still liable?
Oh, perfect way to put that. And the answer is no, they're not. Well, let's put it this way. That's where they can be. If they are untrained in corporate healthcare laws, they cannot be held liable. But there was a Yates decision many, many years ago that said, if a staff involved in let's switch to medical billing at this point. So if your billing person is trained to do things a certain way and know that, let's say, it's illegal to do this or that. We know that we cannot bill all level 5 EM codes for every patient visit. If they have been made aware of that and then participate in an action that violates the law, they can be held individually liable. But they get to claim ignorance. We don't as the doctors, but the staff do. But once trained, they're accountable for their actions.
How can we as doctors show that they were trained for it as well?
Well, with compliance and healthcare laws, you have two choices. You can try to do it yourself or work with someone. doing it yourself is a complete impossibility. It's too big. Not only that, it changes constantly. These laws are rewritten, rules are made, policies are created inside it's a moving target. Somebody I read once said that healthcare compliance is a living, breathing animal, and it is. It grows and it changes all the time. Trying to tackle this on your own is absolutely an impossibility. HIPAA alone is almost an impossibility. But when you tack on a couple of dozen more things, no way. So you really need to be working with somebody. Whoever you're working with should be able to supply you with staff training, all the training in the office that's needed, all the policies that are needed. They're the ones that should be putting things in place that protect you, because now you've done all the checkoffs that you're required to do. They've made the bullseye as small as possible.
Yeah. So besides HIPAA, what's the next, healthcare law that doctors should watch out for?
Yeah. Interestingly enough, everyone concentrates on HIPAA, and HIPAA is probably the most impotent healthcare law out there. There's a couple of reasons for that. It is not investigated very well because the government has no resources to do so, but the government solved that a few years back by creating the whistleblower program. So we don't have federal funds to send out, 100 HIPAA police all over the country and investigate everybody's office, but we can train the public to do that. And that's what they did. And whoever came up with that idea, I hate to say it, they should deserve some award because it's crazy smart. We literally train the public that are in and out of your office all day long to spot fraud and abuse, to spot billing problems, to spot OSHA irregularities, to spot HIPAA things, to spot whether or not you're no surprise, acknowledgement is posted in the office. All these things they can be trained to do, and they report in any fines they get a cut out of. So it's genius. And that's really where most of it is. In HIPAA, that has resulted in a massive backlog of complaints. So they don't have to go out and investigate. The complaints just come to them.
Yeah. I'm just curious, does that set up an abusive behavior where some patients are out there looking for that for an award, unfortunately, and maybe targeting some offices? There was, I think you talked about disability. There was, you have to a translator for the hearing impaired, and you need to pay, that's a law as well. A lot of doctors don't know about it.
Yeah.
But I think sometimes I did have a phone call like that in my office, right? But I think they were searching for that, unfortunately. Like, we do provide that service.
Well,
it's a new patient, so.
Yeah, well, there's no doubt they have created a monster. And some of these whistleblowers are nothing more than opportunists. They've just found a way to make a quick buck. And unfortunately, because of the massive amount of non-compliance, it's real easy to make a lot of money doing that. So yeah, there's no doubt that people are taking advantage of this, and we are growing. So one of the OCR webinars said one of the things that we have noticed is the public is now more aware of healthcare laws than the doctors are. And that's due to advertising. It's due to Dr. Google. It's due to a lot of things. But the public's paying attention to these laws, whether the doctors are paying attention to them or not.
Yeah. The corporate locations, are they exempt from any of these laws?
Absolutely not. Not a single one. There may be some rare applications where some of the things they may not be responsible for, but it's extremely uncommon. Again, the way you have to look at a quote unquote corporate practice is it's no different. It's exactly the same. When the responsibilities under OSHA, under HIPAA, under patient disability, service animals, I can just go on and on and on. You're just another business, and there's really no difference.
Okay. So any unique compliance situations you run with in the corporate setting that doctors should watch out for?
Yeah, I kind of briefly talked about that, about the main problems that come are the interaction with franchisors, with landlord situations. So we've run into some situations where there's employee sharing between the optical that is totally separate from the doctor's office. And one thing you have to do there is you are responsible for that person when they're working for you. So you have to make sure they're trained and knowledgeable in your policies and procedures. And sometimes the franchisors will not allow that. And that puts you in a really bad situation. Sometimes there's no real good solution to that other than really thoroughly documenting the situation and the impasse that you're in, and then hoping the government is reasonable. But that's where we run into some of the issues. Another really good example that just came out is this FTC eyeglass documentation. And there's a lot of stuff going around out there. Well, there's two things happening that are really bad. Number one, we're getting misinformation about corporate practices not having to comply with that law. And that is incorrect. The FTC defined exactly who is under this law. And it did say owners, blah, blah, blah. But one of the key phrases they put in there was co-location. So they made it very encompassing that even the fact that you are in the shared space of an optical, even though you have nothing to do with the optical, you're still under this obligation to have documentation that the patient received their prescription. The other thing that just kind of blows my mind is I kind of follow blogs, honestly, more for lecture information. And then I mentioned that, probably 90% of everything you read on a blog, you should not pay attention to. It's unfortunate, but true. But one of the comments was they were talking about, complying with this law. And the comment was, let me tell you how I'm going to comply. I'm not. Send the police and send me to jail. And I'm like, how short-sighted, number one, can you be? Number two, how silly can you be for spreading your craziness on a social media site? Some of the things that happen in healthcare compliance and the way people just want to ignore them is pretty amazing.
Yeah. Well, I want to thank you so much for coming on the podcast. If someone wants to reach out to you for your services, is there a website, email? Because I think you're a great resource for all these compliance laws. And I think I should have you back on again, maybe for employment laws too.
Oh yeah, we can definitely. The HR is the I'll just make another comment in my presentation on general compliance. When I get to HR, I have a picture of Dante's Inferno, except I call it the compliance Inferno. And if you remember, Dante's bottom of the Inferno is hell. And that's where I put HR, was in hell. So that gives you an idea. But anyone that wants to contact us, info@practicecompliancesolutions.com will get you to client services. I always accept emails to me. Mine's pretty easy. It's joe@pcscomply.com or joe@practicecompliancesolutions.com. Either one will get you to me. I'm more than happy to take the email personally. Our company motto is we're here to help, and that's what we're here to do.
Yeah. Well, thank you so much. I hope the listeners found this podcast informational, eye-opening, and not ignoring any healthcare laws going forward. So thank you so much.
Thanks for having me, and let's do this again.